HEOR have been working on an exciting new framework called Total System Value. Today's episode of Theoretically Speaking features their CEO, Phil McEwan, and CGO, Jeff Anderson, to talk to us about this different approach to value demonstration. Let's jump right in. Can you please explain the challenges that the industry is facing and how HEOR Ltd is helping?
Yeah, for sure. I think the challenges that exist now are very similar to those that have persisted for a number of years now. Ultimately, the demand for healthcare is outstripping the ability of the healthcare system to manage that demand, and of course, affordability is of key concern to payers, and consequently, it becomes super important to ensure that the way in which the various stakeholders within a healthcare system understand and perceive the value that can be delivered by new health technologies is so important, and that's something that's not necessarily fully captured within the conventional cost effectiveness framework. And so the approach of total system value is to consider the impact will be of introducing a new technology into the healthcare system and communicating and articulating those impacts using metrics that are recognizable to the various decision makers and stakeholders within those healthcare systems.
Yeah, and just to add, Phil, I think our clients currently are grappling with this puzzle to be able to combine all of those different elements. And our framework for total system value allows us to have more meaningful conversations with clients, be able to address some of their challenges and needs, but in a way that captures more holistically the drivers of value, the challenges they're going to be facing along the path for product development.
Fantastic. Thank you both. So how would you define total system value, and does it relate to budget impact and cost effectiveness?
Well, it's loosely related, and it uses a lot of the same information. But if we focus on a cost effectiveness model, what that will typically do will be to express the impact of disease management for a new technology compared to some existing standard of care, typically per 1,000 patients or per patient, modeled out over an appropriate lifetime. Now, that's very useful for coming up with an incremental cost effectiveness ratio. But thinking about what the impact would be on the healthcare system, what it doesn't take into consideration are things like population dynamics. And that's very relevant because across many jurisdictions, populations are growing, they're aging, they're living longer, they're becoming more comorbid and more difficult to manage. So consequently, if we want to understand or fully understand what's the value of introducing a new technology into a system, we need to understand how that system is changing, its dynamics over time. I think that's one important component. Another is what doesn't get incorporated within a conventional economic evaluation is the availability of resources to actually manage and meet the healthcare demand. So while we might consider the cost savings associated with avoiding hospitalizations, for instance, we don't necessarily consider things like, well, do we have sufficient capacity in our system to manage demand, or do we have sufficient healthcare professionals or the right number of surgeons and so on? So what we seek to do is to take the same information that goes into describing the natural history of the disease, which is used within a cost effectiveness model, and take information around population dynamics that feature within a budget impact model, and repurpose that information within a framework that's designed to describe how a population level system model will evolve over time, and what will be the impact of introducing a new technology. So really, it's about broadening the value calculation to move beyond just considering the payer, and to think about how might providers, clinicians, patients, and other relevant stakeholders within the healthcare system benefit from the adoption of this new technology.
Okay, that's very exciting. I understand that total system value, or we'll call it TSV from now on, that the TSV framework starts from a perspective of value. Can you explain how you plan to change what different stakeholders consider to be valuable?
Yeah, that's a great question. I think one of the things that I've experienced and perhaps been a little frustrated with over the years is having to try to explain to people who aren't particularly interested in what an incremental cost effectiveness ratio is, exactly what an incremental cost effectiveness ratio is. I think obviously from a payer perspective, it's a very important metric. But elsewhere within healthcare systems, there are decision makers in many different areas, and their lives are influenced by a whole bunch of other value drivers that could be related to things like waiting list targets or managing throughput, being able to prescribe different types of therapies for different types of patients, taking into consideration their particular circumstances and so on. So there's a whole array of different types of decisions that are being made using their own respective value drivers. And so the approach with TSV is to not try to take one value metric like a cost effectiveness ratio and present it to those individual stakeholders. It's to estimate all of those value drivers and calculate and demonstrate dynamically how the notion of doing something differently within a healthcare system, such as adopting a new technology, will influence each of those value drivers using the metrics that those decision makers are used to seeing themselves, rather than trying to translate it from the health economics handbook.
And when our clients come to us and they ask us these questions and they've got these challenges to be able to demonstrate value of their products, it makes you think about how we're set up to be able to answer that question. So our framework is also an internal way of thinking. It's a way of, I guess, organizing our work, organizing our expertise, both in terms of disease area and in terms of methods, and execution of those particular evidence generation studies or value demonstration outputs. That gives us a real chance to be able to address the dynamics, the different drivers of value, and also be able to support, I guess, an improved notion of what value is across the system and over time as well. So we've been organising ourselves over the last few years and more recently to make sure that we're able to be in a position to understand those questions, but also have the right people and the right way of addressing those particular challenges when it comes to delivering our work as well.
That's great. Can you explain the different elements and tools used in the TSV framework, and how does the TSV framework adapt to a dynamic healthcare system?
Yeah, of course. Thanks. So there's two broad approaches that we apply. One is rooted in systems thinking, and the other is rooted in systems dynamics. So one's a qualitative approach, and the other is a quantitative approach, and they act in a very complementary way. The idea of the framework is that it helps us organize our understanding of the evolution of a particular disease within a jurisdiction, whether that's in the US or in Europe. This is independent of the different regions of the world. But what it enables us to do is to reflect on how the population dynamics are evolving within a particular country, how the disease dynamics are evolving, and how that is expected to map onto the ability of the healthcare system to be able to manage that demand. And of course, that has a direct impact on the patient's outcomes, on broader society, as well as environmental considerations. So the total system value framework enables us to organize the way in which we establish what evidence exists at the moment, to describe the interconnections between those various component parts that I just described, as well as understanding how important a value driver they are in respect to thinking about whatever particular technology we're looking to adopt. And so we might find ourselves in a situation where there's a lot of uncertainty about a particular value driver, but if it's a value driver that's of relatively modest impact, then perhaps it's of less relevance than looking at value drivers that would have a much more material impact on the ability of a system to be able to manage demand going forward. So we utilize a lot of standard epidemiological data, a lot of risk equations to describe the natural history of disease progression, as well as the data that's very well characterized in terms of system capacity and the availability of healthcare professionals to be able to understand where the adoption of a new technology is likely to have the biggest impact and the biggest gains for the various stakeholders within a healthcare system.
And we've been testing the framework and working with the framework with a number of different clients already. And I guess what feedback we're getting is the way to think about the evolution of a disease, the dynamics of the healthcare system, where value may be described by different stakeholders, can be broken down into the number of different activities, I guess, that our clients need to address. They may need to identify and define the burden of the disease in different jurisdictions. They may need to build out a comprehensive integrated evidence plan for more strategic planning purposes. They may need to think about what evidence they already have or what they don't have and how that might be commissioned in the future, how it might be optimized. And also things like, we get asked questions all the time, can you help us? Can you help us with maybe objection handling when it comes to submissions to health technology assessment agencies? Can you help us look at the reevaluation of our product once it's been on the market for a period of time? We thought that there was going to be a specific focus for the framework, but actually it can address all of those questions, depending on when you need the question asked, depending on when you need the outputs, and it relates to all of the different recognized study types that we would deliver on a normal day-to-day basis. So whilst we take a different approach to thinking about the situation and the problem, it's very recognizable for our clients in what they need for the purposes of their day-to-day activities as well.
Okay, thank you both. So what I'm learning from this discussion is that with TSV, you don't save money on treatment, you save money by limiting demand.
I think it's not so much around whether or not you save money. I think the challenge with cost effectiveness models is that invariably the new technology may well represent good value for money, but there's often additional expense associated with that. What we're really looking to characterize here is that within a healthcare system that's recognizable to the various stakeholders, where might the greatest value be delivered? And that value metric may translate into real cost savings, but it may represent and reflect improvements that are equally as recognizable, but not necessarily financial related. So, for instance, the avoidance of a hospitalization within a conventional health economic model is related with a cost saving. But that cost saving is rarely realized in clinical practice because those beds are often funded. What you tend to see is perhaps an improvement in the reduction in the waiting lists, for instance, so that there's a relevant benefit to the provider, but not necessarily reflected in a financial saving. So it's a way to translate the expected changes that you would reasonably expect to see through the adoption of a new technology on lots of different factors that are relevant, whether it's to do with reduced inpatient or primary care interaction, greater life expectancy, less time spent in nursing homes. These are all things that are interconnected and interrelated. And what TSV is effectively doing is articulating how those component parts fit together and how they're affected dynamically by a change in one component of the system.
And what our clients really value is the ability of the team to think about the problem, to be able to articulate and bring together, synthesize the evidence around value, and where we're able to add to the evidence as well from the different studies that we are commissioned to do. But equally, how we might enhance that value story and communicating the value to the different stakeholder perspectives who have different value drivers. And that's really important when it comes to, I guess, our overall space in our industry for comparative effectiveness, where the different stakeholders are thinking about maybe more than one product in a particular indication and more than one treatment pathway, more than one indication, or different diseases, comorbidities, all of these different aspects that are driving that perspective on value. Our TSV framework allows us to be able to, I guess, look at that more holistically, but also help demonstrate value at whatever point you want to ask it over time as the system changes.
Okay, really wonderful. So to close out today, how do you see the demonstration of value changing over time, and how can TSV adapt to this changing framework?
I think we'll see value, the evaluation of a value change over time by a recognition that the system that we're operating in is dynamic, and it's easiest to give you some examples of the kinds of things that that this approach makes it a little easier to see the benefits of. So, for instance, over the years we worked on a number of topics. A couple that spring to mind. One is related to increasing the availability of donor organs for organ transplant. That's something that's can be widely seen as being a good thing. But it's only a good thing if there's a corresponding increase in the amount of surgical capacity that exists within a healthcare system. If you just improve one part without improving the other part, you don't gain anything from it. Another more recent example is working in the field of obesity, where there's a lot of debate at the moment around can we afford to treat the number of people who are overweight, obese, or severely obese. And we can use TSV to help characterize and answer the question, can we afford to not treat people? Because if we take the sheer size of the population in terms of patient numbers and how that's growing over time, the ability of a healthcare system to be able to manage in coming years is really going to be tested. Much like COVID, we saw healthcare systems potentially being overwhelmed within a very short space of time with non-communicable chronic diseases such as obesity and diabetes. There's the same potential impact, but it happens over a much longer period of time. And so I think the recognition that we need to be able to predict and project what's going to happen in the future in order to be able to make rational decisions now about how we use our limited resources is something that I think all countries, jurisdictions, and healthcare systems, however they're organised and funded, need to really address in the coming years.
Phil, just as another example, I guess some disease areas have a proliferation of evidence and data that we can use within our framework. Others don't, such as rare diseases. There may be real limitations on the level of evidence that we have. So as a framework, it's helpful because we can look at the interrelationships between small pieces of evidence that we have and whether that corresponds with the value drivers of those different perspectives. Equally, it can help identify where we need to go and gather further evidence and to be able to augment a value story, a value message, and to be able to convey that level of I guess that expectation for commercial return on investment for our clients that they're really they're wanting to achieve. Yes, we can do that with great amount of evidence, but equally we can do that with small pieces of evidence or evidence that's perhaps more uncertain. And by looking at the conditions of the system, by looking at the way that those particular drivers interact and the relationships that exist, then we're able to, I guess, use our expertise. The team have developed those core skills and they've developed the tools, both qualitative and quantitative tools, to be able to describe that within a more holistic, more total system value approach.
Wow. Some really intriguing information that you both shared with us today. Any last words to close us out?
Jeff?
Well, I guess I'm really looking forward to extending this conversation really to those who feel that they've got a challenge. They've got a challenge of either identifying and articulating where value exists for their particular innovative product, where they need to understand and map what the system might look like in terms of where that product may be introduced. That they're trying to get to grips with the different stakeholder perspectives and why particular messages may resonate with some and not others. And so I'm really excited to sort of further this conversation really for those who are, who have a challenge, and we're able to engage with them in a quite different conversation and be able to take that forward.
I believe that we currently underestimate the value of so many technologies by only looking at value from a particular stakeholder perspective. There's absolutely nothing wrong with the methodology that's applied from a payer perspective. It's a very valid and very robust approach to assessing the incremental value of one technology over another. But I think from a broader perspective, the ability of technologies to be able to influence and convey value across the healthcare system and impact stakeholders in a variety of different ways is something that this approach is designed to do. And I think increasingly it will be able to better articulate and communicate what the true value is of a new technology being adopted within a healthcare system.
That's great. I'm looking forward to hearing more from you both. Thank you so much for being here with us today.
Pleasure.
Thank you, Sydney. Appreciate it.
We hope you enjoyed this episode of Theoretically Speaking, and that you'll tune in to future episodes, where we chat with pharma value, evidence, and access experts. Don't forget to subscribe.